What's so impressive about the Fed making this commitment is they're bankers, they're investors. They know the cost and value. And for Indian country, they're saying we need to make that investment. We need to invest in hope. And they know the cost and value of hope for those communities. This morning I went out and did a little walk in the area. There's a park nearby. There was a sign on the park that said, no smoking in the park. Now those of you who've been out to that park, it's very open. For those of us in the East, we often see trees in parks. You don't have, you've got the fields and all of that. No smoking in a park. If you don't know, Helena was one of the places that showed the clearest effect of clean indoor air laws, smoke-free indoor air, where Helena in about 2002, some of you may know the physicians who were here, Richard Sargent and Robert Shepard. Good. When the city council passed a clean indoor air law, heart attack rates fell. It was then challenged in court, and after about 6 months, and the law was, I don't say it was rescinded, but it was delayed in its enforcement then. Heart attack rates went right back up. Couldn't have asked for a better experiment. It showed the value of that. Let's be real clear. That was not health care. That was a community saying, what can we do to create a healthier place for people living here? And Helena was in the forefront of that. We have very large differences in life expectancy across our nation. I don't have the Montana specific data to show you as a comparison. Montana as a whole ranks 29th in the US. 50 years ago, the US life expectancy was about 70, a little bit above what it is for some of our native populations. It is as if 50 years of research, 50 years of progress in healthcare completely bypassed our most challenged communities. And Native Americans are not the only very challenged communities, but they're ones that clearly have great challenges. So we're doing badly, we're the most costly with great inequity. It's hard to imagine how we could have done worse. Certainly if we were in the private sector and those are the characteristics of the product you were trying to sell, you wouldn't succeed. And healthcare is our most costly industry. It's the largest proportion of our economy. At the rate we're growing always faster than our growth in gross domestic product, eventually 100% of our gross domestic product will be spent on healthcare. Nothing for cars, for music, for food, for housing. Not going to happen. We need to make the changes you all are starting to discuss. This is a slide from CDC. It's their summary assessment of what are the types of factors that affect health according to the science. Wider base means the most important for health. The top three are various types of clinical interventions, from counseling and treatment to long-term interventions like immunizations. The bottom two are more about interventions that prevent, delay, or slow the progression of illnesses, that are important interventions that occur outside of a clinical setting, like banning trans fats, smoke-free laws, taxing tobacco, etc. It's important because there are many things that sound good, and the science regarding community interventions has not been as well supported in the past, though it is getting better. And I saw in your materials here a nice report that from the group at Wisconsin doing the county health rankings and I think it was the Chicago Fed, so that it gives you quick summaries of the evidence and what are the things where there is evidence. But there are other places that are starting to do this, the Centers for Disease Control. Because for people out in communities, it's not reading the literature, it's saying, where is the science strong enough that this is what we should do in our community? Third, that there is a concern for everyone. This is core to a community health approach. But there's special emphasis on the poor underserved because they often live in circumstances where staying healthy, or even following the recommendations of doctors and nurses about what food to eat, safe for work in neighborhoods. It's almost impossible for them to adhere to make those changes. And finally, as I just mentioned, there is an interdependence between all the major sectors of a community and its overall health. Let me illustrate this point with a few examples. Think of a woman, maybe in her mid-50s with diabetes, maybe here in Montana, just got health insurance, or at least in some other place. So she can get her medications, her diabetes checked, maybe her eyes and her feet checked so that she doesn't get any of the complications, etc. She'll probably be told she needs to exercise more, probably by walking. She'll need to eat more fresh fruits and vegetables, go to the grocery store. If she lives in a neighborhood that's a food desert, where fresh fruits and vegetables are not there, or it's unsafe or unsavory for her to walk, she's not likely to do those things, not likely to make those changes. So her health will deteriorate faster. She'll need more medication. She'll need more frequent hospitalizations. She will suffer the consequences, the complications earlier, all for things that are outside of medical care. Health insurance is important, but it's not enough. Last week, I was in Minnesota, where the health commissioner has a local TV show, and he had the commissioner of agriculture come on that show. And they talked about how they needed to be working together for foodborne illness issues. They had a big epidemic, and that's what got them started. But it's also about farm safety. It's about pesticides, things like that. They're joined at those areas and more. There was also the Department of Transportation saying they're starting to get interested in complete streets, even for small communities. That is streets with sidewalks and all of that, when they so that people will go to the shops, find it an attractive place to be. Sort of almost like this little development here that we're seeing in some of the cities. He also said, we've set a goal of 0 deaths for pedestrians and bikers. What do we do with our transportation money to create that kind of change? They also had the person from the education department, the woman who heads that, talking about how strong the science is between a life expectancy by education and health. We have very few interventions in health care that provide a year of extra life for each, and in aggregate 9 years of extra life, starting at those young ages. Also, though, looking very much at the importance and the value of early childhood education. And if you don't know that science, it is increasingly compelling that, as you might expect, and I'll touch on this a little bit later, investments in early childhood, turns out, are the ones that pay off the best for society. From food to health care to daycare to schools to transportation to housing to jobs. You'll have to choose 1 or 2 to work on. Choose some where you know you can succeed early, because that'll build, it's like a muscle. Working together, you can get stronger and stronger. So this is the Oklahoma City Chamber. It says, health improvements are an economic development tool. They attract human capital, which attract business. Young talent expects and demands these types of amenities. They expect walkability, green space, bike share programs, public transportation, and healthy schools. Oklahoma City Chamber of Commerce. Here's another, let's see here. Oh, that's when it jumped. Here's another one. If that was there, I missed it. This slide is a quote from another group called Ready Nation. About 1,000 current and former business leaders who are concerned about children and long-term national competitiveness. They are seeing that we as a nation have got to do better for our young children. Rather than read this to you because of time, just let you know that they're there. And I'm going to point out, some of you may know of this. I know some of you know, but maybe not all. This is another group, a report called Saddle Up Montana. It's from the police chiefs in Montana about making it's time to make early investments in kids. You've got a lot of allies out there. Think more broadly than you have before. I'm going to skip that. Well, I want to get back to this. This was also in that the front of that what works. That's the structure of the county health rankings. The maps that Ela showed you largely came from there. It takes a wide variety of measures and shows how they're distributed across the counties. We began this effort about 6 years ago to summarize the health of every county in the nation. You've seen some of those measures, the percent that feels their health isn't good or excellent, and the determinants of the future health of those counties. If you want to look at your county, you want to look at Montana, you can go to countyhealthrankings.org and pull up all of that information as well as the background. I want to make a special point about it. It started as a scorecard. It's turned into a spur to action. About 500 to 700 communities around the nation are using it as they say, what can we do to improve our community and make it a better place to raise a family? Do you know that the single best predictor of poor health outcome, best correlate, meaning years of life lost, proportion that don't feel their health is good, don't feel good. Single best predictor, percent of children in poverty. It is not that poor children cause those deaths or cause people to feel ill. It is something deeper in those communities that needs to be solved. That's why we need to bring together people from all over the community.